Today we're talking about atrial fibrillation, also known as A-Fib, or irregular heartbeat. It happens to millions of Americans. Today we had the opportunity to speak with Dr. Michael Brothers, and he tells us that in the past there was just treatment for A-Fib, but now there's a cure.
This is Healthy Lifestyles presented by East Jefferson General Hospital.
Atrial fibrillation, also known as A-Fib, is a very common condition that afflicts probably 5 million people in the United States. It's also a disease of aging. And over the years, atrial fibrillation has been a real problem because of stroke and disability. Up until about 15 or 20 years ago, there was no treatment at all for atrial fibrillation, with the exception of few drugs. Electrophysiologists like the late Dr. James McKinney started using catheters going inside the heart to approach atrial fib. More recently, we've combined minimally invasive surgical techniques along with the catheter procedure at the same time in many cases, and have achieved a much higher cure rate.
How many procedures have we done, and what can you say is your success rate?
We now tell people we may be able to cure 75 to 85% of patients when we've looked back at least 2, 3, 4 years, and they're able to get off many of their medications, including the anticoagulants. But you have to understand, until not too many years ago, the cure rate for thousands of years was 0. And people carry that burden of atrial fibrillation and its complications with them all their life.
Thank you, Dr. Brothers, and the rest of the team here at East Jefferson General Hospital for being on the forefront of these groundbreaking procedures. Of course, we have all the information you need on our website, EJGH.org.